Welcome back to your healing journey for cancer remission. I am Dr. Carolle Jean-Murat. If you are new, please begin with the Start Here audio. For those continuing the journey, today in episode 3, DCIAM practice session, guided stress relief for cancer patients, I will guide you step by step to the complete Dr. Carolle Instant Antidistress Method, DCIAM. Welcome to this guided DCIAM practice session. In our last episode, you learned why the DCIAM method works. Today, we practice together. This session is designed for you to follow along step by step. You can return to this audio anytime you feel overwhelmed, anxious, or need to activate your body's relaxation response. Before we begin the full practice, let me guide you through the body positions and the 4 steps in detail. Body position. A comfortable posture is essential to prevent undue muscular tension. You can be seated or lying on your back, on a flat surface, or in bed. Some use the cross-legged lotus position. If you choose to lie on your back, bend your knees slightly and use a pillow under them to support your legs. Use a small pillow or pad under your head. Be aware that if you're lying down, you may fall asleep, which is perfectly fine. This is a great technique to use if you have trouble falling asleep. Remember, after you practice this, you will be able to do it wherever you are. If you choose to sit in a chair, sit comfortably and straight. Your feet should rest flat on the floor. Your head, neck, and shoulders should be relaxed. I advise against doing this while standing, as some people may feel lightheaded. Take a moment now to find your comfortable position. Good. Now let's begin. Step 1. Controlled breathing. Slow nasal breathing signals safety to the nervous system. The average breathing rate for an adult at rest is 12 to 16 breaths per minute. When in distress, the sympathetic nervous system activates the fight or flight response, causing our breathing to become shallow and rapid. Deep and slow breathing activates the parasympathetic nervous system, counteracting that response. With over 2 decades of practice, I can control my respiration rate to 6 breaths per minute, and I'm instantly relaxed. Here is how to maximize the power of each breath. Keep your eyes closed and place one hand under your rib cage. Drop your lower jaw and let your tongue lie relaxed and still. It does not matter if your mouth is closed or hangs open slightly. Continue to breathe and swallow as needed. Take a slow, deliberate, deep breath through your nose. Hold it as long as you can. Feel your stomach rise under your hand when inhaling. Exhale slowly through your nose. Let's practice together now. Close your eyes. Place one hand under your ribcage. Drop your jaw. Relax your tongue. Inhale slowly to your nose. Hold it. Feel your body rise. Now exhale slowly to your nose. Good. Let's do 2 more breaths together. Inhale deeply. Hold. Exhale slowly. One more time. Inhale deeply. Hold. Exhale slowly. Beautiful. You're activating your relaxation response already. Now, let's continue with step 2, centering the mind. The significant barriers to achieving the relaxation response are having a wandering mind and being bombarded with intrusive thoughts when anxious. Intrusive thoughts are usually either a replay of past events, which generate anxiety or sadness, or worries about things that may happen in the future. You can become anxious because of a situation that reminds you of a past trauma. How do you stop your internal chatter and redirect your focus? Calm your mind and stop negative thoughts in their tracks. Here is what you need to practice. Close your eyes and consciously focus on the space behind your eyelids. Just notice the darkness, the stillness behind your closed eyelids. Your entire focus is on that space. Relax your tongue. With your mouth closed, drop your jaw as far as it will go. It is okay to open it slightly if it feels more comfortable. Allow your tongue to relax, especially the back of your tongue, as if it is sinking into the floor of your mouth. Continue to swallow as usual. As you continue to breathe, feel your tongue relaxing even more. Focus only on relaxing your tongue and keeping it still. Let's practice this now. While you're breathing comfortably in and out, close your eyes. Focus on the space behind your eyelids. Now, drop your jaw. Let your tongue sink down completely relaxed. Continue to breathe. Feel your tongue getting heavier, more relaxed. Good. Your mind is centering. Your thoughts are quieting. If you are in a situation where you cannot close your eyes, Choose the focal point. It can be a person's eyes or anywhere in the person's face. Just one steady focal point to anchor your attention. Step 3. Positive affirmations. It is difficult to activate the relaxation response when your mind wanders and is filled with intrusive thoughts. Repeating an affirmation will help you break the train of distracting thoughts. What are affirmations? Affirmations are positive statements that help you challenge and overcome negative thoughts. When you repeat them often and believe in them, you can make positive changes. Affirmations are a form of autosuggestion. When practiced deliberately and repeatedly, affirmations have been found to reinforce chemical pathways in the brain and strengthen neural connections. Choosing your affirmation. Make your affirmation in the present tense, as though it is the current reality. Here are a few positive affirmations that have helped my patients and me over the years. When you worry about the past or the future, all is well. All is well. All is well. Whenever you're going through something you want to get over but can't, such as the cancer, the side effects of treatments, or receiving treatment at the doctor's office. This too shall pass. This too shall pass. This too shall pass. Going through something you have no control over. I surrender. I surrender. I surrender. I don't know how many times I have repeated these affirmations. Using your faith. Thy will be done. Thy will be done. Thy will be done. Or, God, I place this in your hands. God, I place this in your hands. God, I place this in your hands. Choose the one that resonates with you most deeply. For this practice, I'll guide you with all is well, but feel free to substitute your own. Step 4, precision tapping. Tapping is referred to as a psychological acupressure and is based on the combined principle of ancient Chinese acupressure and modern psychology. Tapping helps you access your body's energy and send signals to the part of the brain that controls stress. Why the temple area? It's because it's particularly effective for this practice. Here is how. Using the pads of your index and middle fingers on your dominant hand to lightly and rapidly tap your temple. If you're right-handed, use your right hand. If you're left-handed, use your left hand. And if you use both, choose the one you use more often. If you are in a situation where tapping your temple is inappropriate, You can tap the outside of your knee instead. Let me show you the rhythm now. Using the pads of your index and middle fingers, tap your gently and repeatedly. Not too hard, just a light, steady rhythm. Tap, 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 like a gentle drum. Try it now. Tap your tempo while I count to 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Good. That's the rhythm you'll use. Now, we are going to put all 4 steps together for a complete DCIAM practice. This is where the healing happens. Get into a comfortable position, seated or lying down. Close your eyes. Focus on the space behind your eyelids. Drop your jaw. Relax your tongue. Place one hand below your ribcage. Using the pad of your index and middle fingers of your dominant hand, begin tapping your temple gently. Now inhale slowly and deeply to your nose. Hold it as long as you can. As you tap, repeat silently or aloud. All is well. All is well. All is well. Exhale slowly to your nose. Good. Let's take 2 more healing breaths together. Second breath. Inhale slowly to your nose. Tap gently, say, all is well. All is well. All is well. Exhale slowly to your nose. Third breath. Inhale slowly to your nose. Tap gently and say, all is well. All is well. All is well. Exhale fully to your nose and continue to breathe slowly in and out, in and out, in and out. Beautiful. Notice how your body feels now. Notice the shift in your energy, the quieting of your mind. Thank you for listening today. My next audio, episode 4, Understanding the Primitive Heart, how balancing spirit, mind, and body creates the foundation for lasting cancer remission. Subscribe and turn on notifications so you don't miss it. If you're ready to go deeper to release trauma, restore peace, and open the door to cancer remission, I invite you to visit my website, www.drcarolle.com, and explore my services, which include telephone consultations, exclusive retreats, books, audio series, and the opportunity to join me during my live internet sessions and healing concerts. You'll find links in the description below and in the top comment. If this video inspired you, please like, subscribe, comment, share it with someone who might benefit. And remember, healing is possible. Together, let's open the door to cancer remission. Click and keep moving forward, because your journey continues there.